name is Ricardo. I'm here to talk to you a little bit about ViroDet, a community effort on COVID-19 diagnostics that we're implementing in Mexico and Latin America. ViroDet is an initiative created by a group of bioenthusiasts, Mexican scientists, and entrepreneurs who are currently working on development of tools that allow accessible and low-cost diagnostics. We're focusing on the idea of going off-patent, allowing low-cost accessibility, easy replicability, and also a focus in the Latin American region. So these are the four startups that got together talking into trying to figure out where we fit in all of these projects that have been arising. So it's Scintia, NitroCell, Nutrije, and Genobank. So the problem that we see is without a vaccine and appropriate medical treatment, countries in regions such as Latin America are going to be positioning themselves to be the worst hit during the pandemic. And this is already being started to be noticed when you compare the data and numbers from Mexico and Brazil, for example. So we're trying to focus on a regional health system. We want to increase, we notice that increasing the diagnostic capacity of clinical units is a must. We also are trying to understand how vulnerable communities fit into all of the strategies that have been implemented in the past, but also how can we acknowledge them and also focus on them. And we're also seeing a lot of citizen responses to what we are seeing in the news, and also through our acquaintances that work in the medical and health system in Mexico, for example, where we have been provided unreliable case numbers and even suppression of data. So that's something that we also want to target. The solution that we're proposing is that we want to focus on monitoring by providing with these new tools. So this allows us to take preventive measures to reduce the spread of the virus, avoid saturation in public and private hospitals. And we do this by focusing on low-cost and accessible diagnostic module, which is basically working on a real-time PCR thermal cycler and 2 diagnostic kits for the detection of SARS-CoV-2, basically on the principles of LAMP and RT-qPCR, but also focusing on securing and all of the materials required in Mexico. So based on the information that we've gathered, RT-PCR and RT-LAMP seem to be the way to go in terms of affordability and accessibility, and also on the reagents and manufacturing capacity that we have currently in Mexico. On another side, we also know, we have been understanding that in order to run this test, we might need some equipment that hasn't been affordable in the past. But fortunately, we already have stepping stones, like, for example, open devices like the open qPCR that we are taking as examples and that we want to improve upon. We also have the know-how throughout of this previous experiences working with hardware development in some of the startups that I've named. And we also want to provide a successful example for future projects on what the role of Latin American countries and also low middle income countries are in this type of pandemics or events. Also, this wouldn't have been possible, I believe, without the existence of all of the collaboration efforts that are going around, both from the Free Genes, BioRec Foundation, the Open Bioeconomy Lab, and all of the information that has been shared entirely openly throughout the community. Currently, we are in a stage of developing hardware and software by replicating a child qPCR. We're also developing the kits for RT-LAMP and RT-qPCR. So we are also mapping out the supply chain that is required to come up with these devices. So far, we haven't been able to map probes that can be locally produced in Mexico, but aside from that, it seems that we count with all of the required materials. So we're working hand in hand with a few medical hospitals and institutions, for example, Christus Muguerza, that have allowed us to go into their labs and understand a little bit better what's going on behind closed doors. And we're currently trying to raise some funding to keep on with the project. We are currently a signatory of the OpenMTA. We have access to $3,000 and also have access to a ChaiQ Open qPCR. We are also working with the COVID-19 diagnostic kit provided by Free Genes, Open Bioeconomy, and the Open Enzyme Project. We have access to biosecurity level 2 labs in a couple of hospitals, and also access to RNA samples from patients. We have mapped the collaborators that have installations and equipment for pilot production of enzymes. as well as access to Fab Lab prototyping space in Tec de Monterrey. So we will be running a crowdfunding in the months to come in order to keep on funding these efforts, and we're all open to collaborations as well. So, thank you.